There's an island so remote that when someone gets sick, the only way to reach them is to jump out of a plane. Last week, that's exactly what happened. Tristan da Cunha sits in the middle of the South Atlantic Ocean, 1,700 miles from the nearest continent. It has no airport, no runway. Just 221 people, a two-person medical team, and 6 days by boat to anywhere else. When a British man there started showing symptoms of Hantavirus, a rare virus that shuts down your lungs, the island's oxygen supply hit critical levels. There wasn't time to wait for a ship. The British Army launched something they'd never done before. 6 paratroopers and 2 military doctors loaded into an RAF transport plane at Breise Norton and flew 6,700 kilometers to Ascension Island. From there, they pushed another 3,000 kilometers south, refueling mid-air over the open Atlantic. When they reached Tristan da Cunha, they didn't land. They couldn't. So they jumped backwards through the cargo door, free-falling through clouds, with winds gusting over 25 miles per hour. Medical supplies and oxygen cylinders fell separately, tumbling toward the island on their own parachutes. The reason for the emergency was a cruise ship. 3 weeks earlier, 6 residents of Tristan da Cunha had boarded the MV Hantavirus, a Dutch expedition vessel heading toward Antarctica. By late April, passengers started getting sick. Fever, muscle pain, then respiratory failure. 3 people died. Health officials confirmed it was the Andes strain of Hantavirus, the only hantavirus that spreads person to person. The ship turned around. Passengers were evacuated to Spain and quarantined for 45 days. But one of the 6 islanders who'd been on that ship was back on Tristan da Cunha. And he was getting worse. Hantavirus attacks the lungs fast. You start with flu-like symptoms. Within days, fluid fills your chest. You can't breathe. The only treatment is oxygen and intensive care. On Tristan da Cunha, oxygen comes in cylinders shipped by boat. When the suspected case emerged, the island's supply was running out. The 2-person medical staff had no way to handle a patient in respiratory distress. If the man's condition deteriorated, there was no backup. The parachute drop was the fastest option, and the only one. Ships take nearly a week. Helicopters don't have the range. Fixed-wing planes have nowhere to land. So the British military did something it had never done: inserted medics by parachute for a humanitarian mission. The team that jumped included clinicians trained in critical care. They brought ventilators, oxygen concentrators, and enough supplies to stabilize the patient and support the island's medical staff for weeks. What makes this case so unusual is not just the remoteness. It's the chain of exposure. The Andes strain doesn't spread easily, but it does spread. Close contact during the early phase of illness is enough. On a cruise ship, enclosed spaces, shared dining areas, confined cabins, transmission becomes more likely. One infected passenger can pass the virus to others before anyone realizes what's happening. That's what happened on the Hantavirus. The operation also highlights a structural vulnerability. Tristan da Cunha depends on supply ships for everything: fuel, medicine, food. When a medical emergency hits, the island is on its own. There's no medevac. No emergency flights. The nearest hospital is in Cape Town, over a week away by sea. If someone needs surgery, advanced imaging, or ICU-level care, they wait, or they don't make it. The parachute team is still on the island. The patient's condition hasn't been publicly disclosed, but the operation bought time. The medics can now monitor him, provide oxygen, and determine whether evacuation by ship is necessary. If his lungs stabilize, he may recover on the island. If not, the next option is a week-long voyage to South Africa, assuming weather permits. The broader outbreak is still unfolding. 11 confirmed cases. 3 deaths. Dozens more in isolation. European health authorities are tracking everyone who came into contact with passengers from the Hantavirus. The virus has a 45-day incubation period, which means new cases could still emerge for weeks. The UK government chartered flights to repatriate British nationals from the ship and place them under medical surveillance. None have developed symptoms so far, but the risk remains. This is what happens when a rare disease reaches a place with no infrastructure to handle it. Tristan da Cunha wasn't designed for this kind of emergency. Most places aren't. The difference is that most places have roads, helicopters, and hospitals within range. When you're 1,700 miles from anywhere, a single case of the wrong virus becomes a military operation.